First is self-check and portfolio. Second is examination. Third is registration. Remember, the 3 to 6 months bridging program for internationally qualified nurses is out. Since March 2, 2020, the pathway is now called Outcome-Based Assessment. Where to start? Well, just know in Australia, we have AHPRA, Australian Health Practitioner Regulation Agency, and we also have NMBA, Nursing and Midwifery Board of Australia. So like in the Philippines, we have PRC, Professional Regulation Commission, and similarly in New Zealand, we have NCNZ, Nursing Council of New Zealand. It is important to know these agencies so you can go to their website and look at the information and any updates at your own time. For example, in Australia, there are core registration and standards, criminal history registration standard, English language skill, continuing professional development, recency of practice, and professional indemnity insurance. In order to become a registered nurse in Australia, you can study a bachelor's degree here if that's what you want. For your reference, that'll take 3 years. Otherwise, there is also what we call conversion program, which will take about a year. But for now, let's go back to OBA. If you are already a registered nurse overseas outside of Australia, the first step is to complete a self-check. This process is free and the link is available in AHPRA's website. So the landing page will have information about the self-check and some reminders. For nurses and midwives who are currently registered in New Zealand, just know that the registration process is different. I have already created a video about this and you can check the info card above or the link below for your reference. Next is a privacy disclosure. So it's just providing you some information of how your information is collected and used. The next one is a disclaimer page, just reminding applicants that this self-check only provides initial guidance on the assessment stages, and applicants must satisfy the eligibility requirements set by the Health Practitioner Regulation National Law. And with that note, also my disclaimer. I am not an agency. I am not part of any recruitment agencies. I am just an immigrant nurse sharing my experience of becoming a nurse in the Philippines, moving to New Zealand, and now I'm exploring life here in Australia. And actually, if we're just meeting, kia ora, my name is Binibining Veronica. Welcome to the Little Cup from New Zealand to Australia, where I help people prepare for their big move abroad. So if you want to plan better, make sure to hit like and subscribe. Salamat po! So next on the self-check is profession division. So for example, registered nurse. And then it will ask you if you already have a registered nurse license in New Zealand. And again, if you click yes, it will remind you that you may be eligible for registration under the Trans-Tasman Mutual Recognition Act. And for that, it only includes an online application. But obviously, if you are not a registered nurse in New Zealand, then you'll have to carry on with a self-check. It will also ask you about previous registration in Australia and referral letters if applicable. Next, you will be asked to provide information about your primary qualification. So that includes the country where your qualification was obtained, name of institution, title of qualification, and year it was completed. After providing all of those information, there will be a prompt that will ask you to confirm if you want to proceed to the assessment stage. Once you click proceed, it will ask you to create an account with AHPRA. Using the information that you provided, you will be assigned to one of 3 streams. Applicants on each streams have different steps, assessment stages that they need to complete in order to become eligible for registration. The 3 streams are Stream A, B, and C. Stream A are for internationally qualified nurses and midwives who hold a qualification considered to be substantially equivalent or based on similar competencies to an approved qualification here in Australia. Stream B are for those who hold a qualification that is relevant to the profession but is not substantially equivalent nor based on similar competencies to an approved qualification here. And finally, Stream Cs are for those who hold a qualification that is not substantially equivalent or relevant to an approved qualification. Also, please remember, the self-check only identifies the required assessment stages for internationally qualified nurses and midwives seeking registration. It does not assess whether an individual can meet the eligibility requirement for registration. In other words, completing the assessment stages following self-check does not guarantee that your application for registration will be successful. By the way, once you're completing your self-check and for example, you couldn't find your qualification, say it's not available in the drop-down list, just know that once you complete the self-check, you will be advised of the steps that you need to complete in order for AHPRA to assess your qualification and assign you to a stream. The stream assigned, stream A, B, or C, is dependent on which qualification assessment criteria your qualifications meet. On that note, let's actually briefly talk about the criteria. Before you can register to practice as a registered nurse in Australia, your qualification will be assessed against the criteria as listed in this presentation. So criteria number 1, qualification recognized for registration. Criteria number 2, quality assurance and accreditation. Criteria number 3, academic level of qualification. From this criteria, please note that according to AHPRA's website, qualifications that are likely to meet criteria number 2 are qualifications issued by education institutions, so schools, in the countries listed below. So we have here Canada, Hong Kong, Republic of Ireland, United Kingdom, and USA. On the other hand, qualifications that may meet criteria number 2 are qualifications issued by education institutions, so schools in the countries as listed. So we have Belgium, Chile, Hong Kong, Pakistan, Papua New Guinea, and Singapore. And finally, qualifications that are unlikely to meet criteria number 2, so qualifications issued by education institutions in the following countries are unlikely to meet the requirements for criteria number 2. And so you can see that in the screen now and you can have a quick look. So again, when an internationally qualified nurse or midwife completes a self-check, they will be advised if they are in Stream A, Stream B, Stream C, or if AHPRA needs to review their qualification before assigning them to a particular stream. Applicants in each stream must complete a different number of steps, or what we call assessment stages, before they are eligible to apply for registration. And moving forward, Stream A and Stream B applicants who choose to proceed in assessment processes are called to be candidates. Now, let's talk more about Stream B because for most Filipinos that I know, this was the stream that they were assigned to. Again, your individual application will be assessed and reviewed and you will have to follow AHPRA's recommendations. This video is just for sharing experiences and life abroad. For me, I became a registered nurse in Australia in 2015 and this is not the pathway that I took. I studied nursing in the Philippines when I was 15 years old. In Australia, Bachelor of Science in Nursing takes 3 years. In the Philippines, BSN takes 4 years. After becoming a registered nurse in the Philippines, I eventually moved to New Zealand and worked there for the last 10 years. And now I am exploring life here in Australia. Alright, now let's go back to Stream B. Once you log in to your account, you will see the steps that you need to complete. So step 1 is pay the fee. The non-refundable assessment fee is 410 Australian dollars. Step 2 is Orientation Part 1. For your reference, the Orientation Part 1 is an online learning course. It provides an introduction to Australia and the Australian healthcare context. It will take about 1 hour to complete the module. Also, do note that candidates are given 90 days to complete the Orientation Part 1. Step 3, portfolio. This is where you can upload your documents. So this includes documentation about the candidate's qualification, degree, and academic transcripts, proof of identity, and evidence of any change of name. AHPRA will then review these documents and compare it with the information provided by the candidate during the self-check. If it matches the information, the applicant will be advised to continue with the next assessment stage. If the information doesn't match, AHPRA will investigate and advise the candidate of the next step. So that's pretty much a summary from self-check to portfolio. Before we proceed to the next part, if you are enjoying this video, please don't forget to hit like, subscribe, and turn on your notification bell so you will know when I upload new videos just like this one. And if you want to connect with other overseas nurses moving to Australia, please join our Facebook group, How to Australia Nurses Essentials. Salamat po! Next is examination. So for Stream B, the outcome-based assessment is composed of a multiple-choice question exam and objective structured clinical examination or OSCE. Step 4, MCQ exam. So the exam for nurses is the National Council Licensure Examination for Registered Nurses, or NCLEX-RN. The cost of MCQ exam for registered nurses is set by the provider, and I think it's $200 USD per sitting. Candidates who are sitting in an international center will also need to pay additional international scheduling fee of $150 US plus tax where applicable. For your reference, candidates will be directed to the NCLEX-RN registration site via the link on their IQNM dashboard. The registration is open for 365 days. Once you've completed registration and payment, you will receive email confirmation. You will also receive your ATT, authorization to test. ATT is usually completed within 2 to 4 weeks of the submission of the registration. ATTs are valid for 90 days, and candidates should attempt to make MCQ exam within this time frame. After taking the NCLEX-RN MCQ exam, results are sent to candidates within 6 weeks of their examination date. During this time, some applicants may also choose to sit their English test. And actually, question of the day, looking at this processes, when would you rather take your English test exam? Would you do it at the same time you're doing your MCQ, your NCLEX-RN, or would you rather do it at a later stage once you're close to OSCE? Let me know in the comment section below. Anyway, like I said, candidates will receive a formal notification of their result via email, including the next step for their application. So again, for Stream B candidates, they must first do their orientation part 1, submit their portfolio, and complete their MCQ exam, the NCLEX-RN. The MCQ exam must be passed first before they can proceed to OSCE. Now, more about OSCE. The Objective Structured Clinical Exam, or OSCE, is a clinical exam to assess the candidate's knowledge, skills, and competencies at the graduate level nurse or midwife from an Australian NMBA-approved program of study. For your reference, OSCE is an in-person clinical assessment held in Adelaide. The OSCE is completed in a clinical simulation environment to ensure that candidates can meet the standard of practice expected in Australia. At time of recording this video, the fee for OSCE is 4,000 Australian dollars. Instructions on how to pay the fee will be available in your dashboard. For offshore applicants, you will receive an RN OSCE eligibility letter within 4 weeks of OSCE payment. You can use this letter as a supporting document to apply for a visa. Offshore candidates will be contacted via booking selection email to check your availability to sit the RN OSCE upon providing proof of a valid visa at least 3 months before the scheduled RN OSCE dates. The NMBA and AHPRA currently schedules OSCEs up to 5 times per year. The NMBA and AHPRA continue to monitor the number of OSCE candidates wishing to sit the OSCEs and will make days available as able to meet the demand. Exam sessions are being planned for the following months: early February 2023, mid-April 2023, mid to late June 2023. By the way, OSCE consists of 10 stations or clinical scenarios. Candidates are assessed on their practical and communication skills. Needless to say, if you are after the latest and most updated information, then you will definitely have to check AHPRA's website. However, just to give you an idea about the practical skills, so I'll post it in the screen now. So each candidate will be tested on a series of practical skills. These may include but are not limited to vital signs, physiological observation, medication calculation, subcut IM injection, ANTT, hospital resuscitation, disposal of sharps, medication administration, wound care, hand hygiene, therapeutic patient communication, infection control practices, IV therapy administration and management, and risk management in the clinical environment. Your communication skills will also be assessed, so that includes verbal, nonverbal, and written communication skills. If you are keeping tabs of the cost involved with the registration, just know that the expenses would obviously increase if you sign up with a review company or NCLEX OSCE preparation course. Similarly, you'll have to pay fees if you need to retake NCLEX or OSCE. Once you have satisfied this examination requirement, you can now proceed to the next step. And so, Stream B applicants, you have come a long way. Last step, registration. Once the applicant successfully completes the self-check and all the assessment stages, the applicant is now eligible to apply for registration. The registration application form is available in the candidate's dashboard. You can lodge your application for registration and supporting documents by post at the AHPRA's office in Victoria. Supporting documents include official documents for qualifications, copy of course certificate, for example, degree, copy of academic transcript, evidence of any change of name, proof of identity, statement of service from your employers covering the past 5 years, signed and dated CV, which describes your full practice history and any training undertaken, proof that you meet the NMBA's English language skill registration standards. So that could be a evidence that you've completed sufficient education taught and assessed in English, or a copy of your NMBA approved English language test result. Finally, obviously, there are fees for international applications, so application fee and registration fee. The application fee is non-refundable. If it's relevant with your application, you may also need to submit supplementary sheets like explaining criminal history or details of impairment. I will actually put a screenshot here just to give you an idea. But nonetheless, there are also other documents that must be supplied directly to AHPRA from regulatory authorities. So examples will be certificate of registration status, certificate of good standing, evidence of sitting and passing a pre-registration examination from the country where you completed your nursing midwifery qualification, and any additional registration history. Now, to give you an overview, the registration process includes 5 stages which are very straightforward. Stage 1, lodgement of application. Stage 2, AHPRA's review of qualifications, information, and documentation. Stage 3, AHPRA's review of identification and other required information and documentation. Stage 4, NMBA decision. Stage 5, communicating the outcome. And there is a Stage 6, appealing a final decision if you want to appeal the final decision. In terms of the outcome of your applications, there are different possibilities. And if this video gets 300 likes, then I will definitely talk about the registration standards and the registration application process. Remember, before you apply, consider your ability to meet the requirements in order to become a registered nurse in Australia. And also consider your ability to meet the immigration requirements in order to live and work in Australia. If you already have your Australian registration license, then check my video on how to find your first nursing job in Australia. As always, I wish you all the best with your journey and I hope you will be blessed. I'll see you soon. Bye!